Have you ever heard of trigeminal neuralgia? Imagine a pain so severe that the gentlest touch to the face or a slight breeze can trigger an excruciating agony. This isn't a hypothetical scenario but a reality for many people living with trigeminal neuralgia, TN, a chronic pain condition that, while not as well known as other neurological disorders, leaves a significant imprint on the lives of those who suffer from it. The sudden, intense bouts of pain, often described as electric shocks, are both debilitating and life-altering, transforming ordinary, everyday activities into feared and avoided triggers. Although trigeminal neuralgia can strike anyone, it has a preference. Adults over 50 and women are more commonly diagnosed. This perplexing condition can be triggered by the nerve compression from a blood vessel, the deterioration of the nerve's protective myelin sheath due to multiple sclerosis, or for reasons that remain a mystery, even to seasoned medical professionals. These idiopathic cases, where the cause of pain eludes identification, add a layer of complexity to an already intricate condition. Today in this video, we'll delve deep into the enigmatic world of trigeminal neuralgia, exploring its symptoms, unraveling its causes, and navigating through the available treatment options. Each facet of this condition paints a part of a larger picture, so make sure to stay till the end. So what are the symptoms of trigeminal neuralgia? The main symptom is a sudden onset of pain. People with trigeminal neuralgia experience sudden and severe bursts of pain. This pain can come without warning and is often triggered by everyday activities. The pain is typically sharp and stabbing, similar to an electric shock. It's very intense, but usually lasts for just a few seconds to a few minutes. The pain is often felt on one side of the face. In summary, the symptoms of trigeminal neuralgia are characterized by sudden, severe, and short-lived episodes of facial pain, often triggered by everyday activities and touch, leading to both physical and psychological challenges for those affected. So what are the triggers of trigeminal neuralgia? For those with trigeminal neuralgia, encountering triggers is a daily challenge, transforming mundane activities into potential sources of severe pain such as Number 1. Touch and daily activities. Everyday actions like touching the face can initiate pain, making routine tasks like washing the face or shaving a careful process to minimize discomfort. Number 2. Eating and drinking. Meals can be difficult as the act of chewing and the sensation of food or beverages, especially those with extreme temperatures, can incite pain. Consequently, individuals often adapt their eating habits to minimize these triggers. Number 3. Oral hygiene. Activities like brushing and flossing require extra caution. The movement and pressure involved in these daily routines can inadvertently trigger pain, leading to adapted or gentler cleaning methods. Number 4. Environmental factors. External elements like wind or cold air can also prompt pain episodes. People with TN may use accessories like scarves or sunglasses or avoid certain environments to reduce exposure to these triggers. Number 5. Facial expressions. Facial movements from smiling or frowning can be enough to stimulate pain, occasionally leading to reduced social interactions to avoid triggering an episode. Those with TN often develop personalized strategies to mitigate and cope with these triggers, adjusting their lifestyles to limit the frequency and intensity of pain episodes while striving to maintain a quality of life. Living with unpredictable bouts of severe pain can lead to anxiety and stress. The fear of the next painful episode can affect the individual's daily life and mental well-being. Pain-free intervals. Between the episodes of pain, people with TN have pain-free intervals. However, over time, these pain-free periods may become shorter for some individuals, leading to an increase in the frequency of the pain episodes. So how trigeminal neuralgia be diagnosed? Diagnosing trigeminal neuralgia, TN, begins with an evaluation of the patient's detailed medical history followed by a physical examination. The doctor listens intently to the patient's description of the pain, its intensity, duration, and triggers. They will conduct a series of tests to evaluate the facial muscles and nerves, including touching the face to understand the intensity and threshold of pain. It is crucial to distinguish TN from other facial pain disorders, migraines, or dental issues. The distinct nature of TN pain, sharp, sudden, and severe, typically aids in this differentiation. Though there are no specific tests to confirm TN, tools like magnetic resonance imaging, MRI, can be instrumental in offering insights. An MRI can help identify any vascular compression of the trigeminal nerve or rule out other conditions with similar symptoms, such as tumors or multiple sclerosis. So what are the treatment options? There are three main approaches of treatment. The first one is the medication therapy. Management of TN often starts with medications. Anticonvulsant drugs like carbamazepine and oxcarbazepine are the primary choices, helping to mitigate pain by stabilizing the nerve's activity. Tricyclic antidepressants like amitriptyline may sometimes be used to manage pain. However, over time, some patients might experience decreased efficacy of these medications or suffer from side effects, necessitating a change or increase in medication. The second one is the surgical interventions. For those who do not find relief from medication, several surgical options exist. Microvascular decompression, it involves relocating or removing blood vessels that are in contact with the trigeminal nerve. It has a high success rate but comes with surgical risks. Gamma knife radiosurgery, a non-invasive procedure where focused radiation beams are used to target the root of the trigeminal nerve, causing a lesion that reduces pain. Glycerol injection and balloon compression, these less invasive procedures involve damaging the trigeminal nerve to alleviate pain. They offer immediate relief but have a higher rate of pain recurrence. The third one is the complementary therapies. Many patients also explore complementary therapies to manage their symptoms. Techniques like acupuncture, biofeedback, and vitamin therapy have been reported to offer relief. Nutritional therapy and lifestyle changes, such as stress management and avoiding known triggers, also play a significant role in managing TN. Before we conclude the video, it's imperative to warn you that the journey through TN diagnosis and treatment is highly personal, often involving trial and error to identify the most effective strategies for individual patients. A collaborative approach involving the patient, doctors, and support network is essential in crafting a personalized plan to manage and alleviate the impact of this condition on daily life. We want to extend our heartfelt thanks to each of you for spending your valuable time with us to unravel the complexities of trigeminal neuralgia. Your engagement is not just appreciated, it's instrumental in fostering a community where knowledge, experiences, and support intertwine. If you found this content helpful and informative, please give it a thumbs up. Your likes contribute significantly to making this kind of valuable information accessible to a broader audience. And if you haven't already, we warmly invite you to subscribe to our channel. By subscribing, you become an integral part of a community dedicated to empowerment through knowledge. Plus, you'll ensure that you never miss out on our daily content, designed with precision to cater to your informational needs and curiosity. Every like, every subscription, and every comment contributes to a conversation that transcends borders, uniting individuals from diverse backgrounds in a shared journey of discovery, understanding, and wellness. Thank you once again, and remember, every question you have, every answer you seek, and every story you share casts a light on the path of understanding, illuminating not just your journey, but those of countless others in our global community. Stay informed, stay connected, and let's continue this journey together.